Now, some parents in the Tamale metropolis are calling for the closure of schools in that metropolis as sources say 16 districts have recorded measles outbreak. Now, the minority in parliament say they are dissatisfied with the explanation that the vaccine shortage challenge will be fixed in 3 weeks. Now, the health minister, Kweku Agyemang-Menu, Thursday told Parliament that more than $6 million doses of $1 million has been paid to UNICEF to deliver vaccines as the shortage lingers on. Now, this comes on the heels of an earlier assurance by the Director General of Ghana Health Service, Dr. Patrick Kuma Abuaje, that the country will take delivery of some vaccines in the next 2 weeks. Now, the minister says the country should expect to take delivery in the next 3 weeks. Take a listen.
We have had some vaccine shortages in the country since the last quarter of 2022. The vaccines in short supply are BCG, measles, rubella, and oral polio vaccine, OPV. This shortage is nationwide. The recent shortage in vaccines for measles, as regrettably as it is symptomatic of the steady global decline in measles vaccination since the beginning of the COVID-19 pandemic. And permit me to quote from a WHO recent publication on the subject that puts the challenge we are dealing with into perspective. And I will quote: measles vaccination coverage has steadily declined since the beginning of the COVID-19 pandemic. In 2021, a record high of nearly 40 million children missed a measles vaccine dose. 25 million children missed their first dose, and an additional 14.7 million children missed their second dose.
Now, neurosurgeons and the Pediatric Society of Ghana are concerned about the vaccine shortage for children. Now, 2 weeks, two crucial vaccines have been unavailable at the Adaraka Vaccination Center for almost a month now. Mothers who came there to vaccinate their children were turned away because there were no vaccines there. Now, this has become so crucial that pediatrics are now complaining. Neurosurgeon Dr. Hadi Abdullah and Head of Pediatrics and Child Health at the Tamale Teaching Hospital, Professor Hassan Abdullah, have been responding to why their centers are concerned about the lack of vaccines for children.
This shortage didn't just happen this month or a month ago. It's been more than 1 year since we started experiencing these shortages. So it means that for most of the children who were born during this period since 2022, they are likely to have missed so many of these vaccines that are very crucial to their survival during the first few years of life. And the situation is quite bad because, for instance, in the northern region, there is no district that has not recorded maybe an outbreak of measles. So all the 16 districts that we have in northern regions have had cases of measles. If it's just the fever and the rash, generally we are able to manage them as home cases. So you can send them home and then they will be managed at home. But if they develop complications like the breathing problems, then they need to be in the hospital. And this is the key complication that can lead to deaths in children that have measles. And that is why this is a very big problem for, all of us as a country.
The long-term effect of some of these infections, especially measles and rubella, could have an impact on the babies that will be born later on, because some of these conditions eventually could affect the development of the child's brain or the central nervous system, and in some cases the peripheral nervous system as well. So these children could be born with all kinds of brain abnormalities, and we know what pertains in northern Nigeria and some Islamic countries where we've had some Muslim clerics advising against vaccination, and we know polio is still not has not been eradicated in those countries, and we've seen the impact in those countries. In their case, they didn't want to do it, but in our case, we have Ghanaians who are willing to have their babies vaccinated. And so as a country, if we can't get the vaccines, it's unfortunate.
Already, the spike in cases in the Tamale Northern Regional Capital have got parent consent. They've been sharing their concerns with Joy News. Now, Yerafa of our affiliate radio station there is reporting number of cases in the Northern region continues to increase. He joins us via Zoom now with more details. Grateful that you could join us here. Now, we understand you've been studying what has been happening there. How many districts have recorded cases so far, and what are their numbers?
All right, so we know that all 16 metropolitan, municipal, and district assemblies in the northern region have now recorded suspected cases of measles. Our checks across the region indicates that the cases are in dozens. In some districts, we have actually heard, or we are told that suspected cases have hit 100 plus, and health officials in these hospitals are very worried about the situation. They still are calling on government to fast-track efforts to get these vaccines into the country for the hospitals to be able to handle the cases. They fear it could get worse. They fear we could start losing lives. Could you, for instance, in the Karaga district, we are told that at least 85 suspected cases were recorded between January and February alone. But the health directorate there told us some 5 of the suspected cases actually turned out positive. We know, for instance, in the Bimbala municipality, that's the Nanumba North municipality, they've also recorded cases. In fact, I spoke to one man there who said he lost his child and he suspects it is actually measles, even though the hospital hasn't been able to confirm the cause of the death. But he says that his child was suffering all these symptoms, the flu, the severe fever, the rashes, and the running stomach. And so he believes that it likely was measles that caused the death of his child.
What have residents been saying about this development then?
Residents are worried about the situation, especially for parents who have their wards in schools. You know that these senior high schools just reopened, especially for the first years. And for parents whose wards are just reporting to school, they are concerned that the school environment could be a place for the spread of the virus. And so most of them are calling on government to close down the schools if the vaccines cannot be secured immediately. They think that if the vaccines are secured immediately, there may not be the need for the closure of the schools. But if the vaccines are not secured immediately, government should be able or should be closing down the schools to ensure that the virus doesn't spread in senior high schools in the region.
Okay, grateful to you. Now, Professor Hassan Abdul Mumin is consulting pediatrician at the Tamale Teaching Hospital and the Northern Regional Chairman of the Pediatric Society of Ghana. He also joins us via Zoom now for a conversation on this. Prof, I'm grateful that you could join us here. Have there been reported cases of death from measles in that part of the country?
Thank you so much, and good evening to your viewers and the general public as well. We have had, several cases that required admission into the hospital. So these are the severe type of measles, as we would call them. And out of these conditions, we have a number of suspected deaths. In that, some of this. So we have 5 recorded deaths within the Tamale Teaching Hospital since November that had all the features of measles. So your reporter, Yunus, just talked about the children having fever, having the rash. These are the cardinal features for the children that have measles. So they would have fever, they would have the general rash over the whole body, and then they may develop complications. So if they do develop those complications, it may be related to the eye, it may be related to running, diarrhea, and getting fluid loss in their bodies, or they may develop pneumonia, which is having difficulty in breathing, fast breathing, and needing supplemental oxygen supply. So these cases we admit to the hospital, and out of them, we've had 5 suspected that died during this period. The reason why they are suspected is just because after you have the clinical features that we have talked about, you still need a laboratory test to confirm that this is a case of confirmed measles. And that has been a challenge since we started experiencing this outbreak. And that's why they remain suspected, but we have suspected this.
And you said something happened as far back as December, right?
November. So for the teaching hospital, we recorded our first cases in November 2020.
No, I mean the death. When did we record?
So
those
the
deaths?
first ones, in December up to now, we've had like 5 deaths.
Okay, but we've not checked from the laboratory even since December to confirm that they were measles related. We can only say suspected.
No, thank you so much. So we do regular, follow-ups, because these samples are sent to a central laboratory in Accra, and once the testing is done, it's sent through a software, and our public health team in the hospital and all other facilities actually check through the software to be able to tell which results have come back. Since November, we've only had 13% of the tests that we have sent returning. And the rest are still, results are not ready. So because of that, you then have to depend on the clinical features that those children or other patients present with to make a diagnosis.
Now, give us a picture, but you probably have more details. Per what is available to you, what is the picture looking like in the northern region?
Well, so, what Yunus was talking about just confirms that actually we have these cases in their numbers within the community. So generally what we would see in the hospital would be the tip of the iceberg, because that then means that these are the ones that develop severe complications and require to be seen in the hospital. Otherwise, for many families, they may not even bother to come to hospital if it was just a fever and a rash. But if the children start running diarrhea, children easily lose so much fluid when they run diarrhea. If they started coughing and the cough becomes severe, they will require support in the hospital, and they will then get into the hospital. So every day we see, more than 10, or with up to 10 in our outpatients clinic. And within the wards, we admit close to 14. So currently we have up to 14 cases admitted in the Tamale Teaching Hospital alone. Some requiring oxygen, others because they have other complications that you cannot send home. You have to keep them in the hospital. Then the challenge then is that for many of these cases, now we have to admit them to a general pediatric ward because the infectious disease center is not big enough to contain all cases. Then you then put the other patients at risk, those who do not have measles, but for one reason or the other have not had their vaccines completed. They then are also susceptible to having the infection within 10, 14 days, and they may go home and come back with measles. So it becomes then a perpetual, some virtual vicious cycle of, getting exposed, you are not getting the vaccine, you go home and come back within 2 to 3 weeks with measles. So that is a big problem.
So if that's the case, what measures are you then implementing to ensure you're able to contain the spread?
So the best way out of this situation is to get the vaccines and start vaccinating all those who are eligible. because you are allowed during outbreak situation to even vaccinate children who are not up to the 9 months, because measles vaccination in this country starts at 9 months, and then we give a second dose at 18 months. But when you are in an outbreak situation, you are allowed to actually vaccinate below 9 months, so maybe between 6 and 9 months. And mind you, we have seen cases as young as 3 weeks admitted to the hospital with, very clear features of measles. But then if we had the vaccines today, and then the healthcare system, the healthcare workers and the public health team start to work, we could vaccinate all those that require are eligible for vaccination, and do catch up for those who missed during the time that the vaccines were not there.
So, Prof, in absence of the vaccine, what are you doing?
So now that the vaccines are not there, for us in the hospital, we receive the cases after they have started. We receive patients after they have started having the symptoms. So we then have to manage them as cases of measles, to treat them based on the complications that they have. But what we recommend that can be done for those, for families of children, especially those under 5 years, or those who are still under 2 years who are breastfeeding, that the parents should continue to breastfeed. It's important for exclusive breastfeeding, because when mothers breastfeed their young ones, actually the measles antibodies that protect the children from infection pass through the breast milk to is passed on to the infants, and that boosts their immunity and make sure that even if they get the infection, the risk of developing complications are lower. We also need to observe hygiene practices, because it's so important. If this infection, measles, is very contagious. That even if they pass a child through a corridor that has a disease, and then you have stayed within that place, you can get it. So we are encouraging that. At least we should have take our hand hygiene practices very serious, as we used to do during the COVID-19 period. And make sure that when our children have the rashes and they have the fever, they should stay at home. So maybe regarding the school situation, the thing that parents can do is that if your child has fever and has rash, they should rather stay at home instead of going to the school and then getting other children infected.
Okay. Grateful to you, Professor, for joining us. Professor Hassan Abdul Mumin there.